Thank you very much for having me here. It's a pleasure to be here one more time. As we always say, it's such a pleasure to be part of the ALS community. It's such an amazing group of people, and it's always very nice to be able to give back and be here with all of you. So let me figure this one out. All right, so we're going to talk about nutrition, and we're getting closer to lunchtime, so hopefully we're all getting a little bit hungrier now. The big idea here is to bring up some of the topics that are going to help us all understand how nutrition is one of the very important things that we can do very early on the disease process that has potential to help those living with ALS. So I do have some learning objectives that we're going to walk through as we go over the whole presentation today, and hopefully you'll be able to, at the end of this, recognize the importance and the role of nutrition, identify some things that are practical recommendations that you can go back home and put those in practice. Prepare to have an effective collaboration with your multidisciplinary care team, which is crucial, because if you only have an amazing dietitian working with you, it's not going to take you where you need to be. So you do need each one of those professionals to help you through it. And then just that effective communication. If we learn certain terms and certain words that we need to learn, we're better able to advocate for things that we need to advocate for, and you are your best advocates for yourselves and those in your family. So what is the role that nutrition has in our bodies? And we all think that we got this, right? Nutrition, we all eat, we all know what to do, we all know how this goes. And yes, we all know that it gives us fuel for our body. We all know that nutrition is essential for cell growth, for cell repair. We all know that it helps support our strong immune system. So if we are not really there with what we're eating, we have a hard time with disease prevention. And then, as Dr. Ribler said this morning, it's closely associated with mental health and our well-being. So the way we eat can also have an impact in our mood and our cognitive function. And we didn't talk about this before, so it's just real, okay? Macronutrients and micronutrients, Nutrition 101. So macronutrients, what I want you to understand from here is that there are the nutrients that give us energy. So those are the ones that have calories on them. So when we look at foods and when you're concerned about your weight, we look at calories, we look at proteins, we look at fats. Those are all important for us as far as energy providing nutrients at all. They also provide other things, but energy is the main one. Micronutrients, they're called micronutrients because they're really needed in very small amounts, and those are our vitamins and minerals that are part of no, but most of the things that we eat. And then the usually forgotten one is water. But water is very important, especially when we have ALS, as ALS affects your muscles and your nerve cells. And the cells in our muscles are highly dependent on good hydration to be able to be operating. So our bodies are about 60% water, which is a whole lot. It does change dependent on the stage of life that we're at. Water, of course, by itself would not provide us with any energy, but it will provide us with means for nutrients to be transported throughout our bodies. It also helps us get rid of metabolic waste. So whatever we produce as part of metabolism in our cells needs to be carried out and needs to be excreted. So we always hear about our patients that, oh, but I don't drink that much liquid because then I have to take too many trips to the bathroom. But that is an important thing, because you need to get rid of any toxic metabolite that your body produces as a natural thing that is happening. So we're going to figure, as a multidisciplinary care team, what are ways that can be done to help us get to the bathroom, but we don't want to hold back on drinking fluids because of that. Protects your joints, protects your organs, it helps fluidify secretion. So whenever we talk about thick mucus, hydration is going to help that become less sticky, less thick, and Tamara will bring that up on her talk in the afternoon on the respiratory perspective, but good hydration is key for that. And bowel function. That is another one that we hear quite often. And most of the times when I hear from my patients about constipation, my first question is, how much fluid are you drinking? I cannot tell you guys to exercise more than what you already do. Unfortunately, that's one piece of that puzzle that many times we don't have a way to touch. But improving hydration and improving the diet, we can do something about that. So don't underestimate the power of hydration and water. So why is it that we have the whole talk about nutrition? Why is it so important in ALS? So we'll talk about increased energy needs, so simply just needing more calories on your day, helping with our immune system, so being able to fight infections, being able to stay healthy as much as possible. Improving quality of life, so it connects again to our well-being here. And connected to the well-being, we have the social aspect of eating. So eating is just not eating for the nutrition of it, but there is the whole social perspective behind mealtime and behind eating what we eat. Supporting our healthy respiratory system, this goes deeply into hydration and bowel function, both hydration and what we're eating. Reducing fatigue and slowing down muscle breakdown. So this is, promise you, this is the only more research-oriented slide that I put on the presentation just to give us the background, and this is all research evidence-based, okay? So about half of our ALS population has what we call hypermetabolism, which means that we're burning more calories without doing any more activity than we were doing without ALS, and that is at rest. Muscle wasting and muscle loss. So muscle loss, which is known as sarcopenia, this is a common part of the aging process. After the age of 50, we start losing muscle mass, and this is just a natural process. Now, when we talk about weight loss in the context of ALS, this is an independent predictor, which means that if we keep everything else stable, nothing else is progressing in your disease, the only thing that's happening is weight is going down, this already indicates poorer prognosis, so reducing survival time and also quality of life. So can we do something to try to pull that brake and slow down the weight loss than we see in many of our patients? And this is what I started to talk about, that this is something we can do early on in the disease. Okay, we don't need to wait until, okay, I think I've lost enough now, and now I'm gonna start doing something about this. Please don't do this. Do something about this before we start that process. Difficulty swallowing, which dysphagia is the word that you're going to hear about sometimes with some of your practitioners. At some point in the disease, it's estimated that 80% of our population will have dysphagia, which means that's going to impact how much we're eating. That's going to increase the risk for aspiration, which is something that you work very close together with your speech-language pathologist to determine safe textures and things like that. GI issues are pretty common just because of denervation and because of different things that we are able to eat or hydration on its own. Constipation is very common, and sometimes we have diarrhea, and that's manageable with nutrition. And if there's a need for medical management, your healthcare team will be able to help you with that too. Fatigue, weakness, and mobility issues. So this impacts the ability of our population to prepare meals, to eat, and things like this. So the whole support system being strong and being present in order to fill in those gaps while keeping you as independent as we can do it. So how do we conquer those challenges, right? So there's going to be some practical tips for us to talk together. Please note that this is just for a presentation, not specific to any individual patient, just my quick disclaimer here. So the first thing that I need to talk about is how important a multidisciplinary care team is for those living with ALS. And this is also research-based, looking at the comparison between people with ALS who are seeing a neurologist who are specialized in that versus those who are seeing a neurologist that is part of a multidisciplinary clinic in which you do have the other professionals that you see. and there is a difference in terms of survival time. Definitely those who are seen by a whole multidisciplinary care team have better survival. The clinic could be hospital-based, could be community-based. It doesn't really matter as far as you have a multidisciplinary team taking care of you, which kind of makes sense, right? Because there's just so much happening and so many things to be addressed. So once you have a team working with you, we have better results. The usual assessments happen every 3 to 6 months in most of those clinics. There is the coordination of care, but one piece here is very important, is communication. If you go to your appointment, if you see that clinic team, you want to be able to ask the questions. And here, we usually see the perspective, many times caregivers, and, oh, is this a good question? Any question is a good question. If you have a question in your mind, you need to be comfortable enough to ask those questions, because we are there to support and to answer any questions that you may have about your care. So increase energy needs. The first thing that helps us is calories. For those of you who are my patients here, you hear me talking about this. What comes first, calories or protein? Calories will always come first. We think protein and muscle, right? And this is how the whole food industry survives, and those very high protein supplements. And we put a lot of emphasis on that because most of the population is not really concerned about not losing weight. They actually want the opposite. They do want to see weight loss and preserve muscle mass. For us, we do not want to see weight loss, so we need to have the calories first. Otherwise, all that protein that you're making all that effort to eat is going to be broken down to give you the calories that you need. So we need the calories from the carbohydrates, which are the most quickly utilized by muscle cells. And we're starting to have more studies looking into different diets, and the diets that are higher in carbs, especially the quick release of energy carbs like your pastas, your white breads, and things like this, are showing to be beneficial and protective. And again, this is quick energy for your muscle cells, and your muscles are twitching, your muscles are working out without you intentionally trying to have them work out, and we need a fuel for it. So that is very important. The only thing I usually tell people that you should avoid is anything that's sugar-free, fat-free, low calorie. You want to have the full regular version of any foods that you're eating. So if you're buying sour cream, you're buying regular sour cream. If you're getting, if you want to drink soda, drink a regular real soda, unless you have other comorbidity, and that's to be discussed with your healthcare professionals. If we don't have that much of an appetite, it's easier to eat little by little. So many times it's overwhelming to think about a big plate placed in front of you and you eating that. But if we eat it in small bits and you add it all throughout the day, you're going to end up eating what you need to eat. So eat often, eat small servings, and eat foods that matter. Eat foods that are packed with calories. And I think we all know that part, right? We all knew, at least before disease, that how we were trying to control weight gain, right? And you want to do exactly the opposite of all of that. So you can look at nutrition labels, especially when you're buying those Ensure Boosts and protein shakes. Don't go only with the protein shakes. Look at the calories. The number that we usually aim at is at least 300 calories in a bottle. So that is what we're looking for, and the protein is always going to be there. No company is going to make a high-calorie, zero-protein shake for you, so you don't need to worry that much about that. So we talked about this. High glycemic index carbs are those simple carbs. Think about what an athlete would eat before they go run a marathon. That's kind of the foods that you're trying to always have part of your intake, okay? Never too early. And the oral supplements, so your Boost, Ensures, and others like that, are shown through research that they do support weight maintenance. So preventing weight loss, those are a big part of it. Can you make them at home? Definitely yes. There's ways to make those shakes at home and have them with different flavors and maybe things that you prefer. Most of our patients have increased fluid needs. So we talk about drinking enough water, right? So not only for a normal requirement, but your needs are even higher with ALS. Think about, for those that have excessive saliva, there's a lot of fluid that goes into there, and there's a lot of fluid loss with that, okay? So we want to make sure that we use some tricks, whatever works for you. If it's, for some, it's buying that favorite bottle that looks amazing and that by itself just increases fluid intake tremendously. By the way, if you have kids, that works amazingly with children as well. Just get them a bottle they like, they'll drink the fluid. Take beverages with you. Always bring them with you wherever you go. Carry your little bottle with you. And anything counts. So if it's a popsicle, it's nothing else than a liquid that's frozen. The only thing that I don't really count is beverages that are caffeinated, so coffee or any type of energy drink, which I hope nobody would be drinking those. And the second one is alcoholic beverages, because both of those are diuretic, and both of those are going to cause dehydration. So if we're drinking them, it's okay if you drink them, but just know that if you're drinking a cup of coffee, you want to also drink a glass of water, because you're dehydrating with the coffee, but then you're replenishing it with the fluid, and you can still enjoy the liquids that you like, but on the right way. If there are foods with high water content, so eating soups, eating puddings, certain fruits that have a high water content on them, they all can help. And again, if we think about urination, we may want to slow down how much liquid we're drinking towards bedtime, so you don't need to be waking up as often, but throughout the day, drink enough. Low appetite and eating fatigue, I spoke about this. So we spoke about eating small, eating often, favorite foods, and snacks that you can eat. Eat with others. Eating by yourself can be quite boring. So the social aspect of eating is very important. Eat with company. That will make you more likely to eat a little bit more. Try to have the intake of your larger meals at the time of the day that you're less tired. So for most, it's the morning time. For some, it may be later on the day. So just think about, when are you less tired? Take advantage of that time to have a nice meal. And naps. Naps are amazing, and when you wake up, you may have a little bit extra energy to be able to have a nice meal. Chewing and swallowing difficulty. Here is really individualized, okay? So it really depends on the safe texture that's determined by speech-language pathologists and their assessments. But reducing distractions when you feel that you frequently are coughing when you're eating anything, paying attention to what you're doing, concentrate on it, and keep those suction machines nearby. They are life-saving devices, and they can't do much if you're eating in the kitchen and they're in your bedroom on the second floor of the house, locked into a closet. So they need to be handy if needed to be used, especially at mealtime. Oral hygiene. So if you're drinking water and your mouth is clean of food residue, and you by any chance end up coughing with that water, it's a lot less likely that you're going to have food residue there, and that's going to end up on your lungs. Now, if you had a meal, didn't really brush your teeth after, and you end up coughing and choking with a sip of water, whatever was in your mouth, from food residue to the bacteria that was already feeding on that food residue, is going to end up on your lungs. And that is what we don't want to see happening. So oral hygiene is very important. And again, work with your team, okay? There is always going to be a case. Constipation, some key things: hydration and also fiber. Now, those two things work together. I cannot have gummy fiber without hydration. It will do the opposite effect. So if we are adding a lot of fiber, but we're not hydrating, that's going to bulk up on your GI tract, and it's going to do the opposite that we usually think with fiber. So fiber has to come in with proper hydration so that it works. Probiotics work amazingly. If you don't like any of the foods that I have listed on the slide, you can always go with a probiotic supplement. As a dietitian, I will always tell you that foods come first, but it's okay to use a supplement if we cannot get there with the foods that we like to eat. I love kefir as an option for probiotic for our population because kefir is a very creamy texture. And if you get the kefir that's made with whole milk, it's going to be high in calories, and it's going to be super high in probiotics, so that's a lot of times better. Squatty Potty or any little stool. So if you want to buy the original thing, yes. If you don't want to buy anything and use your old textbooks from when you were in college and put them under your feet, it works perfectly fine, okay? Just the positioning of elevating your feet when you're sitting down at a toilet. And then if you're able to walk as much as you can, okay? And this is, of course, it's never going to fit everyone. Self-feeding difficulty. Our occupational therapists are amazing on providing ideas for things that can be used, okay? Modified utensils. Just make sure that they're not heavyweight, because when you go to buy those online, they have the bulky utensils that are lightweight, but they also have the bulky utensils that are heavyweight, that are good for people with something like Parkinson's, with the tremors, because you have a heavier weight. For us, when we have loss of fine motor skills and you're weaker in your upper extremities, using something that's lightweight. The T-Rocker knife is one of my favorite ones because it allows you to cut food with only one hand, so that can help. Elevated table, the different types of straws if you have the strength to be able to use the straws. And working with your mind to accept the help. So we want to promote independence as much as you can do by yourself, but if it's something that you can't, those that are helping you with love. They're helping you because they love you and because they're there to do this for you. So give them an opportunity to help you instead of not allowing the help to come. That is very important, to help with intake. And I talk about those things because it impacts nutrition. Sometimes I see our patients that are not eating enough because they can't get to open that container. So that is the time that, okay, let somebody else have a chance and help you out. And work with your OTs and PTs that are amazing. Now, the last point here is feeding tubes. And when we talk about feeding tubes, it's always a very delicate discussion, and I think we look into a lot of different things that are happening with our patients before we go into those recommendations. But timing is the most important thing that I want you to remember from what I say about feeding tubes today. Timing is very important. If we do it too early, it may just be there without being used for some time. It's not going to hurt, but it may not be the right time for it. But if we pass the right time for it and we wait too much, it is a lesser chance that it is going to help the way it would be helping you if it's placed on the right timing. So the timing is the timing to prevent weight loss. We don't want to wait until, okay, I lost so much and I'm unable to swallow anymore and now there's no way I can eat. And this is the time I'm going to talk about this to my team. We don't want to wait that long. We want to have those discussions early. Bring it up, ask questions. There is no way that we can expect our patients to make an informed decision about the timing of a feeding tube without knowing what it is. How is my body going to look like? What is this going to do with me? How does it work? What do I put on that tube? Can I have beer on my feeding tube? I don't know, we can get any questions from you. Whatever questions that you may think that may aid on your decision to go for a feeding tube placement or not, ask those, okay? So there are some red flags that we look at: meals becoming very stressful, choking becoming very often, and unsafe, unable to really reach what you need to reach. And it works for both things. So a feeding tube works for fluid intake and for food intake with nutrition. So it's both hydration as well and nutrition. And then the breathing, okay? So most of the guidelines still are following the 50% vital capacity for breathing for feeding tube placements. I have to tell you, in practice, we see that happening in different timings. But think about those timelines here for feeding tube placement. So final takeaways from what we talked about today. I think the most important here is multidisciplinary care. Second, communication and collaboration. So you are not alone, and you should never feel that you're alone. But if you have a question, if you have anything that you need to clarify, please ask those, because the team is there for that. Nutrition is highly important, and nutrition is one of the things that you can do from the moment you get a diagnosis, okay? And don't wait. Don't wait to start thinking about what should I be doing with what I'm eating and what I'm drinking, because that can make a difference from early on. Calories are before protein, so always think, number one, calories. Number two will come protein, and then everything else in your diet. Don't forget hydration, that's also very important. But also be proactive, okay? Just you are responsible to stand up for anything that you think is not the best way for you, and talk to the team about those. And if you don't have a dietitian as part of the team that you're working with, please ask to talk to one. I'm sure they can find one for you. And we do half of the job. You guys do the other half of the job. So your care team is there to give you the guidelines and to tell you what is recommended. Your job is to make that decision if you're going to listen and follow or not. And I can give you the best recommendations ever, or anybody in your team can give you the best recommendations ever. If you don't do the other 50% of the job, that's trying to get it to work on your day-to-day life, we cannot go home with you. So we need you as our partners in getting this to work. I think the slides will be made available, and I'm open to any questions that you may have. I can hear you. I can repeat it. So the question is on vitamin D supplementation. So vitamin D is one of the simplest micronutrients that we can assess if people are low or not low on in their body. So if there is a question on that, I would suggest vitamin D assessment is pretty simple and not expensive. Vitamin D over supplementation. So we don't have anything that shows that it would be beneficial. And there are concerns about over supplementation with vitamin D because vitamin D accumulates in fat tissue. So it's a fat-soluble vitamin, and those have toxicity levels. It's not like B12. B12, you'll excrete that on your urine, and there's not much of a risk to over-supplement, and we know it has been shown to have positive effects. Vitamin D is a little trickier to try to go over. Now, if you're somebody who don't spend that much time outside and you're not a big dairy fan, it might be okay to supplement with vitamin D, but it's easy to check the levels. But we don't have anything specific with vitamin D at ALS. Any more questions? Yes, there is one question. I can hear you.
Just one point I wanted to bring up. I've been doing some research on, what do you call it? And, the drink. Ensure. I'm sorry. And it seems to me recently that Ensure came out with a new drink that's got 350 calories and 28 of the protein. It's called Complete. And I hadn't seen that before. I just wanted to mention that there is a new Ensure that's got 350 calories per drink, which is pretty good, pretty potent. That's all I want to say.
Thank you. And there are several of those out there in the market, so look for calories. Again, your lower number would be on the 300s. Anything less than that is really lower in calorie for what we're looking for. There are some that have much more than that. Thank you.
You were talking about vitamin B12, and I did the B12 shots for about 6 weeks. And the information that I read on it recommended, like, 25 milligrams a week in order to, like, see any real progress. And most of the places that will give you a vitamin B12 shot will only do like 5 milligrams. Do you have any additional information that you can share on vitamin B12 shots?
So thank you for the question. And because when we do B12 in shots, this is a medical prescription, I won't go deep into that. I will defer the question to our Ask the Docs session that will happen today at 3:30. And I will let the medical team answer your question.
Thank you.
Thank you. Wrap it up. If anybody has any questions, you can come. Liz, you have quick?
Just one quick, oh, sorry. I won't take too much time. Thank you, Dr. Charvet. That was excellent. Piggyback on your mention of multidisciplinary care, I just want to say one comment about access to food. Never worry if you have challenges accessing the extra food to obtain these extra calories. Do not worry about qualifying for SNAP, formerly known as food stamps. You can simply Google Feeding America, and it will connect you with a food bank or food pantry in your area. And second to that is if you have insurance through a commercial policy, not Medicaid, not Medicare, I have seen often where the formula is not approved. The procedure is, but not the formula. So then you're looking at having to pay out of pocket for the formula. Correct me, Dr. Charvet, $60 a carton?
At least.
So just anticipate that
pack,
as you
not a
develop your nutrition plan. Thank
Yeah.
you.
Thank you, Liz. And I'm sorry I overlook including the access to food idea, which is very important. Liz is our social worker in our clinic, and she does an amazing work in directing people to the resources when access to food is a problem. So that is another thing not to be shy of bringing up to your care team, because it is crucial. If I'm asking you to eat more calories, but you don't have access to that, there is always help. Well, thank you, everyone. And